Now to the push to get more Ohioans vaccinated as new variant of coronavirus is causing more concerns around the globe. Our senior health correspondent Monica Robbins is here now. And Monica, Vax-A-Million, of course, ends this week. And it looks like we're not going to hit herd immunity by July 4th.
Yeah, not likely with the vaccinations. The Vax-A-Million, though, it did give Ohio a bit of a boost getting people vaccinated early on, but then it waned. But there are some other things that may help get shots into arms, just not as quickly as hoped.
A recent Kaiser Family Foundation survey found that nearly a third of Americans are waiting for full FDA approval before they're comfortable getting the vaccine. Then we may also start seeing more mandates.
After you have full FDA approval, there's very little standing in the way of a company requiring their employees to get vaccinated.
She also thinks getting vaccines into primary care doctors' offices would help if they can be stored and administered safely.
If you can go to your doctor, chat about your blood pressure medicine, chat about your heart, and then get your COVID shot, I think a lot of people might go for that.
Lastly, the Delta variant may also play a role.
When outbreaks start happening and people start getting hospitalized, maybe that'll scare people. I hate to use the stick, but if the carrots aren't working.
She says there's no way to know when those vaccinated will need boosters. Breakthrough infections in study participants who are coming up on a year since their first dose will be the first to tell us.
They'll kind of be the canary in the coal mine, and that's one of the main reasons why the study is ongoing.
As much as she'd like to say natural infection would play a part in herd immunity, she says studies show protection in those over 65 wanes rapidly. Younger people may have about 85% protection for a few months, while those over 65 may have just up to 25%.
Natural infection doesn't provide a ton of immunity for people over the age of 65. And so I don't think we can rely on natural infection to get us to herd immunity together with the vaccine. I think we just need to get more people vaccinated.
So both Pfizer and Moderna applied for full FDA approval, but that's a lot of data that has to be combed through. So at the earliest, we might see it by the end of this year, if not early next. I hope I'm wrong. I hope it happens sooner rather than later, but I think that's what we can probably estimate.
Gotcha. Okay, let's talk about vaccination rates in Ohio and nationwide. Where are we right now?
Nationwide, we're at about 53% of the population that has had at least one dose. 45% are fully vaccinated. In Ohio, we're at 47% has had one dose, 43% fully vaccinated, and it's really unlikely, obviously, that we're going to get another 20% of the population vaccinated in the next 2 weeks to hit the president's goal.
Yeah. Okay. Monica Robbins, thank you so much.